Joining us this evening for our number 2 budget review session. We'll turn the meeting over to Chair of Ways and Means Legislator Philip Fields.
Thank you very much. Tonight, we'll start our meeting off. We'll actually skip around some pages again as we're reviewing the operating budget, and I would like to call on the county clerk, who is present here, to talk about the county clerk's budget and also DMV's budget.
Good evening, everyone. Can everybody hear me okay? All right. So, this evening, I have the honor of presenting 2 new ideas that you'll see in our proposed budget for the county clerk's office.
I'm sorry, what page is it again?
46.
Thank you.
46.
So this is the first time in my decade of experience with the county clerk's office that we have new ideas and some new proposals. I'd like to start with the RMO, if that's okay with you guys. The position of RMO, which stands for Records Management Officer, was previously bestowed upon the IT department. In almost all counties in New York State, it sits with the county clerk, since what we do in our office is maintain records, preserve records, and in paper and digital form, organize them. So in 2022, we will be handing over the torch of the RMO position from IT to the county clerk. And what I would like to do is turn that into an actual department. It would be more than our singular employee in the archives. It would be a staff of 4 people that would have a deputy. It would have an archivist. It would have a scanner. And it would have a technician who is responsible for the physical moving of the boxes. A lot of the titles we're working on right now, so they're a little bit in flux when it comes to what the actual positions will be. But the biggest component of this proposal is that we need to start digitizing our records in the archives. We are currently past capacity in what our building can afford to hold. We have, as of September 30th of this year, 17,858 boxes of records in a facility that is only slated to hold 17,500. There's a current expansion that's underway in the archives that will provide about 3 years of space before we outgrow it. So digitizing our records in the archives is of the utmost importance. These are things that can be stored electronically. There are documents that can be destroyed once they are scanned electronically, and then there are better ways to organize the paper documents that are left behind. Based on the current usage of the space in the archives, we wouldn't make it through 2024 before we've filled up the expansion that's not even completed yet. You'll see in the proposal that we're working with a company called Laserfiche, which is on state contract. They are one of the leading companies in providing digitization software to local governments and other agencies that are responsible for data management and organization. We've been working with them to decipher what kind of program would be best for our use, what kind of hardware we would need as well, and we've had multiple meetings with them to decipher how best to move forward starting in January of 2022. So that's the biggest component for RMO, is turning that into its own department, giving it a staff, and giving it a new purpose. Besides moving boxes and providing boxes, we're now going to begin digitizing. The ultimate goal with Laserfiche as our vendor is to also then allow each department their own access to their archived records without needing to pull the paper boxes. So it's incredibly important that as we move forward and we digitize these records, we're doing it responsibly, we're doing it methodically, and we're making sure that every step of the way we're accounting for what documents we're scanning, who they belong to, what they are, and how to organize them electronically. So that's that section. As far as DMV goes, if you would allow me a moment to tell you a story, I would like to explain to you how I came to this new proposal. A few months ago, I received a document from New York State DMV that was a revenue projection for all of the county-run DMVs for 2022. Schenectady County was slated to have roughly a $4.2 million revenue from our office, which is about on par for what we would normally have with standard business practices. And I started looking at our neighboring counties, which are much larger and have higher populations. Of course, their revenues were higher, but something struck me. There was a county up north, very similar in size to ours when it comes to population and DMV employment, and their revenue was $34 million. And so I did some digging. How can a county with a population similar to ours and a DMV presence similar to ours make that much more in revenue? And it turns out that there is a huge need for additional processing support for dealer work, automotive dealer work out of New York City. So this office fields the work to themselves via FedEx or UPS to supplement their downtime and also provide a huge boost to revenue. So when we look at my proposal for DMV, the end goal that can be phased in over time is that I would like to open a dealer processing center in the vacant space next to our building. That center would have a front-facing window for local dealers to walk their transactions in, because right now dealers are using our Dropbox. They're not yet processed in office, so it would provide them a forward-facing customer service counter so that they can be processed in person. But it would also be a resource to start fielding in additional work from New York City. It can grow as fast as we would like it to, or as slow as we would like it to, but what it also does is it provides us a bench of support, so that if there is a day when our customer-facing DMV gets hit hard with kids that are sick, people in quarantine, we've seen some really big curveballs. You've got 5 people right next door who can come out and help the people in the lobby. And if there's a slow day and bad weather and you've got 12 cashiers and nobody in the building, you have a processing center right next door that's going to provide backup work to keep everybody busy. So the work is there. Our DMV team is excited about the prospect of this new endeavor, and I think that it's something that we could absolutely be successful at that would benefit all residents of Schenectady County. So those are my 2 biggest budget proposals. Everything else is pretty standard. If there's any questions, please let me know. I brought all of my notes, and I will do my best to give as much specifics as I can. Thank you.
Thank you very much, Kara, for your presentation here on the county clerk's budget and DMV's budget. Do we have a question there?
Yeah, I like the idea. I was just curious if your employees, I know you like the downtime sometimes when you're working, you check your email, you check your texts, whatever. Did you get any sense from your employees how they're gonna feel about, oh, you're not busy, maybe you can go over to the processing center?
Right, that I think was one of the most exciting components. So right now, all of our staff rotates through the building. They'll do 2 weeks at the front counter assisting with giving out forms and numbers, and then 2 weeks at the permit window. And the permit window is slower, so that's kind of like the break, where you get, to slow down a little bit. You don't have a waiting room full of people watching you. But the prospect of having 2 weeks or more in a processing center next door, where you can have your earbuds on and you don't have to worry about people, and you're just, you type away, you do your work, it's almost like a vacation. So they're really excited, and then you come back to customer-facing service and you feel refreshed, you had a break, you're not burnt out, so it actually provides a really nice balance for the staff.
There are many questions. Go ahead.
Mine is more of a comment. I am so excited because this is innovative. One of your ideas is actually revenue producing. The other will very much likely save us money because we won't have to keep expanding our space or buying new space or taking over more of our highway department's buildings. And I really, in my own experience with our constituents, public records that are digitized are so customer friendly, and I've had the opportunity to walk our residents through when they've needed to search through, with your help, some of the public-facing records, knowing that our staff can also access their own records with such ease, I think will change their productivity in a whole different level. So I'm very excited for these ideas, and thank you for bringing these new ideas.
Thank
to the
you.
table.
Ms. Angeles, Ms. Randy?
Same here,
Terrell?
thank you, Kara. Hey, how long do you think before that processing center would be up on plane and running? Do we have to build something?
No, so there's actually
That-
vacant space
okay,
right next to our
yeah.
DMV. It just needs to be retrofitted. It's to the studs. So we would have to just retrofit the building, procure workstations, and we would transition already trained employees into it. So that new employees we typically train facing customers. So it could be operable as soon as we just get the building set up. And then you can grow organically. You know, start small, test the waters, and then as you get new people trained, you get more work, and you kind of build that over time. It's not something that I want to, you know, for lack of better terminology, you know, you get too big too fast, you run out of work, or people burn out. So slow and steady.
No, I deal with them every day, so I know what you're dealing with.
Yeah.
And then the other thing is, did you want to put something in the budget for shredding? Because once all those records need to be shredded.
There's already a contract through RMO that's being moved over eventually for shredding. What we would have to identify is how quickly we can shred the documents once they're digitized. I'm anticipating, since the contract won't be signed until 2022, we have to get workstations, an industrial scanner. We've been working with Image Data on what scanners they recommend for high volume jobs that maybe in 2023 it might be worth looking into that, because we'll have to build the department before we get to the point where we have.
Which brings me to my next question, sort of off of Legislator Oster's saying. So can the public access their own records online once they're digitized?
The archives wouldn't be open to the public.
Okay.
They would be indexed to the best of our ability, working with each department to understand what documents they're preserving and how they would like their documents to be organized with respect to what tiers of access people would need to have. But since the archives themselves aren't open to the public and there's no way to ensure what documents would be where, that would be more for the departments themselves accessing their records to then share with the public should they need them.
Last one's a compliment. The Tuesdays and Thursdays walk-in. I mean, I sent you 2 clients today.
Wonderful.
And it's just, you know, I deal with all the counties in New York in the insurance business. And it's like, well, you know, Albany, you still have to make an appointment. And I was talking to somebody today who actually lived on, I believe, Draper Avenue. And I'm like, it's Tuesday, just walk in.
Okay. Thank
Oh,
you.
Thank you for that.
Thank you.
That's awesome that we have that here, because the other counties do not have walk-in. Rensselaer's a little different. They have a walk-up window, but no other counties have walk-up right now or walk-in. So awesome. Good
Thank
for
you.
you.
And Mr. Pascarella, we, in the budget, put in $20,000 to actually deal with a renovation at DMV to accommodate the extra space that will deal with the records coming in from New York City.
Mr. Chair,
Yes, Mr. Hughes.
one quick additional question. Do you have an idea of what the potential demand is among out-of-area dealers for a service like this?
I do. So I spoke to the county clerk in the county up north who is doing this to ask how they came about this program, how long they've been doing this. She's a newer county clerk who inherited this and has been actively turning away dealers seeking to work with them. I also was in touch with New York State DMV, and I obtained a list of all New York City dealerships looking for work to be processed outside of the city. It is a 30-plus page document. So the work is there. I just have to open the portal.
Sounds like you'll be busy.
I think so.
Ditto on the good ideas. They're both good ideas.
Thank you.
Nice to see innovation
Thank
coming
you.
out of that area.
Mr. Russo.
So, thank you, Kara, great job, outstanding work. I'm sorry I walked in slightly behind the scanning conversation. Are there documents that we must keep in paper
Absolutely.
or original form?
Absolutely.
Okay,
We've been in touch with the New York State Archives, which largely handles all of the retention schedules. What we're going to be doing moving forward is running all of these things by them. My hope and my plan is that the deputy who's going to be assigned to the archives is going to assume the position of go-to records management and data retention schedule expert. If we can help train all of these departments and department heads in their own retention schedules, we won't end up with boxes upon boxes of miscellaneous things that are pegged indefinite when it comes to retention. Right now, the vast majority of boxes that we have to hold on to are retained forever. They're indefinite retention. And a lot of those things may not be. It's just that there was never somebody who could discuss all of these things, or somebody who had all of the knowledge to direct those department heads. There's never the time. So we're gonna give that position to the retention schedules. Somebody who can be an expert, work with state archives, work with the departments, any other agency that may have their own retention schedule, because I know especially within DMV has their own set of retention schedules, so does the state. So there's different layers of people that you're accountable to. We would like to be a resource so that we're accurately holding on to the things we should hold and not holding on to the things that we shouldn't. And that's something that's incredibly important, especially when you consider FOIL requests. If things have a certain lifespan and you're holding on to things indefinitely, you're responsible for providing all of that data that you're holding on to indefinitely. One of the biggest pieces of the Laserfiche software is that once we scan things, it's also searchable by word. So it has in its software the ability to understand what words are in the documents. And if you need to search something that has a certain name or an indicator, you can search in that system, payroll, and it can bring up records so that as you're moving forward and you're trying to, discover what retention schedules you're working under and things that can be destroyed, you can easily identify what records you're looking at.
That's great work. I'll repeat what my colleague said, which is just outstanding. Thank you for top grading clearly this department and bringing this level of capability to our county. Well done.
Thank you.
Well, I want to thank if no further questions, I want to thank you, Kara, for your presentation and also for the new ideas that you brought to us. And I hope that going forward, we will generate enough money in the county because your office generally generates more money than you actually spend. So you're one of the positive generating agencies, departments, should I say, within the county. So thank you very much. Appreciate it. So with that, we will begin to look at the beginning of the book. So we'll start roughly on page 4 of the book there, it says. So roughly we'll go from page 4 to page 9, page 8, which actually speaks in the area of the legislative budget. So this is the area where for the clerk of the legislature and the staffs and the expenses there. Again, most of the changes that you're seeing in the department request or the manager request do reflect the 2% and 2.5% and 2.25% increase. So there's some adjustments taking place within the line, the modified line, and also the manager's recommended line. So that's primarily what's happening there. If you have any further questions in the county clerk's office, clerk of the legislature, any questions there? We're making a small change. We have audit and control, which is actually starts roughly on page 9, which the contents show up on page 11. Just some small adjustments we're doing there to put in the deputy auditors. Our next is the Board of Ethics, which is on page 12 and 13, and is primarily no significant changes there at all. In the area of the court security services, again, just being zeroed out. And then on page 15, we have the district attorney. So we begin to make some adjustments in the district attorney's office to change around some of the people who have departed, and also bring up certain salaries of the earlier people who have entered into working for the department, and the mid-level people. We're looking to just adjust their salaries to reflect what is being paid in the market. The next area of discussion is the county public defender's office, which starts on page 21. Again, you heard between the the public defender and the conflict defender and all those areas of discussion. The caseload is still high enough, even though the COVID had been taking place over the last year and a half, almost 2 years now, year and a half. So we're just making some adjustments there. Any questions? Yes, Smiley.
Mr. Chair, I'm just curious about the new Schenectady County Family Treatment Court. If maybe the manager could speak to that for a moment.
Sure. Family Treatment Court is kind of a cross-pollination between probation, family court, DA's office, and the public defender's office. So it's still in its concept stages. It's a very good concept, and they're still working towards it. The goal is, is set in the books that they want to get it up and running in 2022.
Is this something that exists in other counties, or how did it originate?
No, yeah, this is something that exists in other counties, and it's just, if you ever spend a day in family court, there's so many dynamics going on that it's kind of like when we went to drug court. There's so many offenses that happen, and years ago, Schenectady County was in the forefront of initiating drug court, where an agreement between the DA and police realized, listen, we're not going to prosecute this person, but something still has to happen, whether it's mandated treatment or some sort of lighter probation. You can divert the person to drug court. So it's the same kind of thing. So, whatever things are happening with that family, it could be an issue of treatment. So instead of going through the rigorous family court process, could prosecution and the police agree with, okay, we're not going to fully press charges if everyone agrees to go to family treatment court. Could be a counseling, could be drug treatment, could be anything. But it's a good idea.
Sounds good. Thank you.
Any questions in the area of the conflict defender? We're up to that, 26, 27. Assigned counsel is 18B. No significant changes, any changes on the town justices that we normally do. The medical examiner, which is on page 32 and 33, it is no real change there at all. Okay, the county manager's office, which begins on page 34, and the data is on 35. The Office of Finance, which is on page 36. They talk about doing their proceeding into the new accounting system.
I promised Mr. McPhillips if we had any questions about finance that he could answer. So we just had a question about the financial budget, sir.
I'm sorry, Mr. Fields, what was your question?
Well, the new accounting system that we're looking to.
Yes, thank you. So if I can take an opportunity maybe to steal the limelight for a bit and then cast it back to the individuals at both the Department of Finance and the Division of Purchasing, who over the past year and a half have worked diligently on a number of projects. We were able to successfully complete our annual audit for both 2020 and are very close to finalizing that audit for 2021. We had a successful 2020 budget process, and depending upon the actions of this body, hopefully a 2021 budget process as well. And one of the largest undertakings over the past year has been moving our integrated financial system from the existing platform to the Munis application hosted by Tyler Technologies. It was a very, very in-depth project. Starting back in January, we had a hard and fast deadline as of December 31st of this year to be off the old system onto the new system. There are many, many hours of work dedicated by both Division of Purchasing staff as well as the Department of Finance staff to meet that deadline, while also maintaining the daily operations of the department in the middle of a pandemic. So there was a very, very difficult task. We went live with the new Munis application on October 1st. Departments have been trained. We are offering additional trainings as additional modules come on. We rolled out the core financial modules first. our accounts payable, accounts receivable, purchasing and procurement. There are other modules that will be rolling out over the course of the next several weeks and months, including budget development and monitoring, as well as a revision to the existing payroll personnel module, because we had that module already in place, but as we were rolling out additional modules, we need to sort of reprogram the payroll personnel module so it sort of better syncs with the other modules that we just went live with. So to the staff at both the Department of Finance and Purchasing, I tip my hat to all of them. So it's been a success thus far. Any transition to any financial system is bound to have its hiccups and hurdles, but the dedication and staff, dedicated staff that we have in the department, will make sure that those are short-lived.
Thank you very much. We'll move to the area of purchasing, which begins on page 42. And it runs to page roughly 45, 44. And advertising for foreclosure is on page 45. We just had that yesterday, putting out for an auction. We had reviewed the county clerk's budget, which began on page 45, and it will continue all the way to roughly page 50, and so that's been completed. And now we're into the law department, which is headed by the county attorney and the staff that's sitting on the side here. Again, they're just making some small staff changes, but no anything significant. The Department of Human Resources and Civil Service and the Commission, which begins on page 55. The Engineering Department, which is on page 59. The Board of Elections is the next area. Which is run by 2 election commissioners, and they're continuing to do their public service. Page 64 begins the Department of Public Works. Again, you're looking at our roads and facilities. Facilities is on page 66. IT Department, which begins on page 71. And I know IT is doing some things in capital, so we'll get to that when we're there. And then, of course, we finish up this section here with the page 76, with the insurance and the dues and the taxes that we actually pay to the various county taxes and the sales tax distribution. Page 79 roughly begins with the community college and our contribution that we make to the community college. So here is page 80 is the chargebacks that we have to pay. The page 81 is related to the monies that the county actually provides to the community college, and aspects dealing with our new debt service requirements that we generally do provide a 50% match. Preschool special ed, which is on page 82, which is consistent. and our handicap parking program. So the next page we'll look at there is on page 88, which looks at the Unified Community Communication Center, which is on page 90, 89, 90, 91.
Just a question on dispatchers, are we, I think we did some wage.
Yeah.
We earned up the wage to see if we could, you know, get some pressure off that
We are nearly
recruiting.
full employed out there. We are at a historic near full employment, which de-stresses our dispatchers for sure. We have a batch right now of 8 that are being trained. Typically, about 50–60% of that batch will make it. So we're in a very good spot out there. I just got a very nice email from Kevin Spawn, our director out there. Typical Saturday night, 3 to 11. They do about 300 calls, you know, in that 8-hour shift. So there's really, you know, they're contained. They're in one building. They're you know, the fact that we were able to bring in all the towns together to have more people to backstop all these calls and all these references to get things out to the appropriate people has been really good. Our Northern Rivers contract is going very well. This year we've had 46 referrals, so where a police officer did not have to be responded to the scene, where Northern Rivers psychologist, basically, or social worker went to the scene. We've done our training with our 911 operators for, you know, maybe it doesn't have to be somebody that responds to the scene. It just maybe the person's just looking for somebody to talk to, you know, and so maybe they need a depression hotline or suicide symptom hotline kind of thing. So we've had some very good things happening past 18 months out there.
So we'll have, yesterday we discussed the sheriff's office, which begins on roughly 94, 95, 93. We're skipping that for a second. Probation, page 100. So we have probation, we have the adolescents, we have the we did jail and jail medical yesterday. We did the targeted street crime, all that yesterday. So we'll jump to page 111, which is alternatives to incarceration. Stop DWI.
Yes.
Just a question, Mr. Chair. So are we tracking the success of these programs? Because there's a lot of them and they seem to, just on paper, seem to be something that could be a success.
Yeah.
What
yeah.
metrics do we have?
You know, alternatives to incarceration, it's, again, it's almost like a pre-trial, you know, diversion in some ways. You know, when you read through here, Schenectady County Reentry Task Force, Career University curriculum, those are all numbers we can get to, but we've been doing this for years, and there's definitely a lot of successes, even so much so we get referrals from state parole, you know, for Schenectady County residents that are coming out of state jail, coming back to live in the community. We can get, you know, kind of some of these career counseling type situations moving with Career University. Drug court, you know, the Scram bracelets that we use are incredible. It's a bracelet that you put on somebody that's agreed to wear it for 60 days to ensure that they're not drinking. We have like a 100% non-recidivism rate for either getting rearrested, or, and these are like chronic people that are getting their 8, 9, 10 DWIs. We did 60 in 2020, and all 60 scram bracelets on individuals in that year, 0 were reoffended. So, you know, those are really real numbers. And these are things that our Office of Probation does all the time through referral or through their own folks, or if a judge orders it. So it's two ways. Sometimes it can be diverted with the decision between the DA and the police department, or the judge themselves can direct these people into these programs.
Are any of these programs that would call for further investment? Or is that already worked into the budget based on past history of
Yeah, I mean, you know, Center for Community Justice is a broad group. You know, they're always out, you know, privately trying to raise money. Same with Center for Community Justice. So those are places that we have funded for years. You know what I mean? So I'm sure if you talk to one of their board members, they would say yes. But you know, I always point back to our Office of Probation. You know, they silently do so good work with, you know, reducing recidivism and kind of monitoring and keeping tabs on these folks that are fresh out of jail. Remember, with bail reform, we let a lot of people out, and so probation got busier, you know, frankly. And so we do a lot of good things in-house that aren't necessarily these other not-profits that can help us through contracts. So our Office of Probation, juvenile probation, working with youth in very similar situations. We've been busy, you know, we've been busy, not too busy where we need to hire more, but we're always looking at, because there's always the safety issue or the safety concern, because at times, you know, counseling can go a different direction quickly. You know, that's why our folks are very well trained. They have a lot of enhanced bias training. They have a lot of bridges out of poverty, you know what I mean? So the training for your average parole officer, or I'm sorry, probation officer, or caseworker over at DSS, they're really trained highly in Schenectady County to make sure that they're affecting, you know, the goal of what they're supposed to be doing, which is helping the person.
Great, thank you.
Yeah.
The Office of Emergency Management, which is on page 117. Page 121, 122 really, it actually relates to some of the expenses that the county put forward to help with the emergency fire services for the volunteers. Our next section is looking at public health and mental health. And so the Public Health Department, which starts on page 125,
Mr. Manager, is there a line item in public health that we're bolstering as a, you know, forward forecasting defense element, you know, airborne pathogen, more education? I'm just going to handle it as it comes.
So one of the powers the Charter of Schenectady, New York has vested in me is to at any time reorganize the department. This budget reflects the manager's office reorganizing public health. We're actually, frankly, merging community mental health services with public health. You know, the fact that opioids are, you know, kind of taken care of in different silos is not acceptable. So not only are we bringing Darren Samaha's crew over to be part of public health to strengthen kind of what we're doing, we're creating unit heads. You know, 10, 12 years ago, Schenectady County's public health was renowned for their response to Ebola and H1N1. It was more of a preparatory stance of knowing how to put that call bank together, knowing how to deal with that emergent pandemic that could be happening. You know, when I came into my office, the pandemic toolkit book was this big dusty thing on the corner. In the past 12 years, we've had a lot of attrition in our Office of Public Health. So with all the money that came in because of COVID, we've been able to start supplementing. We've been adding positions along the way. We really determined that it was time to reorganize it to something that similar looked like 10, 12 years ago. So yes is the short answer, so that we're ready to go next time and not be in the same position we were a year and a half ago.
Appreciate you bolstering our capacity and capabilities. Thank you.
Yes, our next page, we're on our way to, my goodness, there's a lot of pages here. Any questions on page 144? We have the County Office of Community Services, which deal with behavioral health treatment issues. And these are some of the grants that we give out to the various local organizations. Most of these are 100% pass-through grants. Mental health services, any questions there on page 150? This year, being that many people were affected by COVID, the question that's always out there is, was the services yet provided for the people in mental health that needed it? Because of the fact of COVID, some people weren't interacting with them, and they themselves perhaps weren't taking care of themselves. So I don't know, have we done anything with the employees that work in that field as we deal with the public in that regards?
Yeah, a lot of our mental health funds are truly pass-through funds. So we, fund New Choices, we fund Northern Rivers, we fund Mohawk Opportunities for case management, for medication assistant management, for the supervised housing or assistive housing, or independent housing. When COVID came, mental health acted similarly to normal health, where meaning just less people sought out those services, so less people were going to the hospital if they didn't have to, and frankly, less people were seeking out their mental health providers. That doesn't mean that there wasn't still mental health issues happening. Telehealth, started to become more the norm. We're able to still carry forward a lot of those tools that we had to do. It depends who you talk to. Some people really believe that things like mental health was strengthened because now you could bill for a session on FaceTime, or you could bill a session over the phone. So maybe we're offering more service to folks with whether it was a homeless issue or a mental health issue or those kind of things where it just needed to have an interaction with a counselor. I don't know if the truth is yet written on that yet, but I know it's another tool that we can use, so we're excited about that for sure.
I know many people are excited about the new settlements that has come from these companies and the opioid treatment companies that have at the national level and the state level.
Yeah, so we are in line at some point to start receiving opioid funds, from all the lawsuits that are going on. We do have one settled fund, so in this budget we've booked $300,000 revenue for an opioid settlement. There will be more coming. As a reminder, this county receives, $1 million a year in tobacco settlement, so and there doesn't seem to be an end to when that's gonna stop. So the opioid situation may be a very similar thing. Going back to the merger over at Public Health, our interim public director, Keith Brown, is actually an expert in the opioid field. So, we have things like opioid task force where it's a cross section of people meeting, whether it's from housing or mental health, public health, police, that meet, but to better integrate, the information that maybe the police have and mental health have and public health have, to really get it to more in more of a centralized place so we can better direct our resources. That's a perfect example of something that our epidemiologist has the ability to do, to be able to analyze that data and direct, nursing or police to, a high incident area. Maybe it's Ten Eyck, or maybe it's a school, or maybe it's a hospital. So when Rich asked about strengthening public health, opioids are certainly on the table as far as things we can do better. We do continue to send, as a pass-through, a lot of monies to community mental health agencies and community agencies for opioid therapeutics, but also the treatment side or the prevention side. I believe Inspector Force said something, the definition crazy is arresting the same guy 30 times for stealing stuff, So how can we tactically with data get to that person, and cross-sharing the information? Because if it's just police that has this data and not maybe the social service side, well, wait a minute, do we know where this guy lives? Do we know if he's on a caseload? Do we know if the caseworker who's working with the person, realizes that they were arrested yet again for shoplifting? So it's definitely about the share of information. So that's, the thought on the changes at public health, and really almost just readdressing and redoing our opioid task force, because there has been a result. There has been, further abuse with opioids, or the obvious fentanyl crisis that's out there because of the stress of COVID. And we're in an interesting time because federal supports, are stopping, so the public may start to have less, those federal checks coming in. So there might be a pivot back to more traditional increased DSS caseloads, or increased need for our public health to react to these crises. I think it was about 5 or 6 months into the COVID pandemic, there was a batch of fentanyl that went through Schenectady County that was really harming people. And so we actually put out a public alert, to that effect. Something that we had never done before, but it's just time for new strategies.
So on page 152, we're actually seeing an increase in spending for court order and contracts for mental health.
Yes.
That's where some of the monies is being reflected.
Yeah, yep, just on the action that was heard in committee yesterday, and you guys will consider on Tuesday. Slow increases, yep.
Our next area of discussion is related to the transportation area, which looks at public transportation, the roads, the aviation portion. So aviation starts on pages 155, which deals with the airport and so forth.
So the addition of the air traffic controller is completely paid for by the Air National Guard.
Page 159 is our contribution for CDTA. The Public Works Department, which begins on page 160. Again, some of these discussions pick up in capital, but
I have a quick question. Page 164, the increase in materials, could you elaborate on that? Is that just the increased cost?
Yeah, unfortunately, yes. Yeah, wood, concrete, steel, rebar, chinks in the supply chain. It's all just got expensive quickly, and so it's hard to forecast out past the year. We do believe that those prices of commodities will come down and won't be that stark when we're planning for 2022 23, but that's exactly it.
CHIPS funding, that's on page 165. Snow and ice. Some of the costs are here. And then we look at the employee benefits to this particular area on 168. Again, there's different funds in the Public Works Department, the D&E fund, so here we have, again, these things repeat in different ways, which starts on page 171. And I guess when we discuss capital, some of the road improvements statistics actually come out as we spend money there to improve the various roads, and the rating that we have within our county is very good. All right, we can proceed now to the area we call Economic Assistance and Opportunity Programs, which primarily deals with the Department of Social Services and Economic Development and various programs that the county runs, which begins roughly on pages 177. Primarily, which is the Department of Social Services. And I guess the best thing to say, because if we begin this area, is any highlights that you'd like to expand on this particular area, goals that we'd like to achieve in 2022? Primarily, we're still maintaining the same services that we're doing.
I'm sorry, sir. I didn't know you were asking me a question. Just what I covered last night in the budget, you know, it's even with the pandemic and our office really switched gears to having a lot of more state allowance of filling out those TANF forms over the phone. That was a tremendous help, still getting things to people that needed it during the time of pandemic. We've still been given that flexibility to achieve that. You know, things have been flat. You know, we're not gaining customers, I would say, but things have remained flat. If anything, you know, within the past 5 years, we've had a slight trickle downwards. But again, you know, the 2022 is certainly going to be the state of flux. It's hard to forecast where we're going to be in 6 months from now. So a lot of the budgetary items you're seeing is very similar to what we had last year. We're truly trying to keep things stable. You know, we're always proud of our foster care system, 20 adoptions, you know, over 80 kids in foster care at the moment. All of our grants for all those activities are still sound and still unchanged, and everybody's looking forward to implementation of Family First. You know, that's really groundbreaking stuff.
Yes. And we haven't seen any uptick in additional people coming in for public assistance this year?
No, not yet, not yet. And I feel like, you know, we're waiting and waiting and waiting,
Yeah.
you know?
Since unemployment checks stop, you know, or what's, questions, what's happening next?
Yeah, Commissioner Paul Brady will say that there's usually honeymoon time. You know, it's like a 6 to 12 week thing. You know, after like a stimulus like that happens, that you know that we could be hit. So, you know, do I believe winter's coming? Yes, not as bad as last year. You know, but could over as the winter months come and people maybe having more hardships. It could raise. It certainly could raise. I think it would be prudent to remain our budgetary levels and not try and take money out of the Department of Social Services budget. Yes, Ms. Meisner.
What is your reasoning that you think that the foster care program has declined? Is it birth rate related?
You know, I think you know, COVID was like a big weird blanket over everybody, so a lot of things just slowed down. You know, the reason for having to remove children from homes is the reason why we have foster care to begin with. Those things just seem to slow down. You know, so meaning there, you know, possibly there wasn't as much abuse happening, or possibly things were underreported too. Kids weren't going to school. You know, and so those great teachers that maybe see something and say something because they know something's wrong couldn't do that last year, but now come back this year, maybe we'll get that referral source again, which is, of course, the right thing, but
There had to be a lot of pressure during that period of time, that's why I was wondering
Yeah.
why it declined.
Yeah.
That makes sense.
yeah. But overall, our 5-year average for the number of kids that we've had to foster is down, so that's positive. I'm always glad to see those numbers.
Thanks.
I'm sorry, Mr. Chair, will our Families First legislation support fall on the backs of caseworkers or senior advisors? How will we
Yeah,
implement?
it's just gonna have to be implemented, so there was a lot of training that had to happen for all our caseworkers and how to implement it, you know, and the new strategies for trying to divert kids to family-known places to be diverted. You know, sometimes those things can happen quickly in a safety plan if something quick is happening. You know, if an appropriate person at social services identifies like an obvious grandmother or an obvious aunt, then it can happen very quickly. There are other situations where there's just a stratum of training that has to happen before you can just deposit a kid somewhere.
And then can we just shift gears to Code Blue and our capacity to support last year? I don't think the need was diminished, but the COVID blanket, you know, changed lots of things and lots of actions.
Yeah.
Will we have more capacity going into '22 or prepping for or anything like that?
I mean, we're probably at the same place as far as capacity as we were last year and even 2 years ago. You know, interesting, you know, one of our sites, the Monastery, you know, we're all worried because of COVID, and they do have like a larger area we can spread out the cots or spread out the mattresses. We're like, oh my God, we're gonna put, you know, 20 homeless people, you know, in one room. And it just never happened. We never got the crush of people, and so we don't know if just the decision to go out onto the street had slowed down. We are again renewing that contract with Bethesda. So at one point, you know, from I can't remember from 1920 or 2021, where we flexed to the church across the street for an extra 18 beds, which was wonderful. It really worked out very well. We're committed to doing that again.
Thank you.
Page 187 looks at our Medicaid spending. That we put in the budget there, you talked about that, just kind of maintaining almost a flat level and being benefited from the federal government with the FMAP, the additional FMAP that's saving us a couple $1 million.
That's right. That's right. So Chuck Schumer gave us good news last year. We're hoping and praying that we get those good news again.
Page 189 is the area related to the Glendale nursing home, and I know that we follow the state mandate and just making sure that our employees have been vaccinated as of last week, right?
Yeah, I'll add something that I wanted to mention last night. Newsweek magazine again ranked our Glendale home very high. We were ranked last year. This year we were ranked in the top 6 percentile in the state. Out of over 600 nursing homes, we were ranked 41st. We are the highest ranked county-run nursing home. You know, it's a testament to the times. You know, being in a nursing home, running a nursing home, it's a very difficult business. You know, I worked in it for 20 years. The fact that we have stable employment from our long-term folks, and nothing was more representative of the Maxine Band-Aid. You know, you saw that in other places where people just had the choice to move on. There's a lot of movement in healthcare. You know, a nurse may only work in a place for 5, 10, 15 years. But our Glendale employees, you know, have the benefits of benefits, and they want to stay there for 20 and 30 years. So when other nursing homes, you know, had 20, 30 people that they were letting go because of the vaccine mandate, we only let 4 go, you know, spread across 3 shifts of nurses, so we weren't affected. The fact that, again, an outside rating agency like Newsweek, you know, rates us so high is just a great thing. And I know last year we did some marketing on it, and probably do the same again this year.
I noticed that we added an infection control coordinator in the nursing home. It's new this year.
Yeah, we've done a couple of things. So opinion of our last administrator was that we didn't need a full-time infection control person. The new opinion of the new administrator that I'm backing, just like I backed our previous one, does want that full-time person. So we are asking to shift back. We are asking for an assistant controller out there. It's a $32 million independent fund. It's very complex as far as dealing with Medicare, Medicaid, reimbursements. Our person out there potentially may be retiring in the next year or 2 or 3. So it's very important that we're not left high and dry. The changeover in the business office has been wonderful. Rensselaer County, Albany County, nursing homes actually outsource a lot of their work in their business office. For years, we had that in-house. We have since fully executed that, and just in 2020, it was somewhere over $1 million of more revenue we brought in just from the efficiencies. It did some things like changing Medicaid contracts so we were paid weekly instead of monthly, going after people that maybe weren't paying their bills a little more aggressively than maybe our past folks did. So we've had some pluses out there. Nursing home is in a tough place because we're, our case mix, because we at times have had our residents artificially low out there where we purposely weren't bringing people in because maybe we had a COVID positive on a wing or somewhere. We were trying to not have as many patients in there. That affects revenue. Our case mix can be tricky, and how we're a lot of coding that goes on when a patient gets transferred from acute care to a nursing home. We're really, Todd's kind of discovered that we could be coding better so that we could be presenting a higher need case mix, meaning we would get more money for the patient. So we're working on some things to improve that. I have a lot of faith in the new management team. One of the things that they asked for was the full-time infection control person. It was actually our idea from management and finance to try and get an assistant comptroller out there. So there is those asks. Early in the year, this body already decided to, the union labor actually came to us wanting an extra evening cook. So it looks like an extra number, but that was already decided on earlier in the year for our Glendale home. And I apologize, this is where IFM comes and strikes. Is this reason why it looks like a grid is in order to get rid of the grid, we would have had to completely rebalance the entire document. So I apologize about the grid from here going forward. You'll suffer through. Thank you, Legislator Gatta. Thank you.
Mr. County Manager, may I?
Sir. Yes, sir.
Each year, we should be proud, by the way, of the nursing home and its ratings, and shouldn't say I'm surprised, but number one is in the state is pretty tough to get. But each year
number one for county-run nursing homes.
Yes, right.
Yeah. Okay.
Yeah, I understand that. Each year, the county nursing home has been running a deficit, although the deficits have been decreasing as collections and expenses have improved. What's the bottom line to the county nursing home as it stands?
We're doing about a $4 million ad this year, but that's really driven by the lower census and the change in case mix rules from the state health department. I was really happy and proud of our changes in the business office, so it looked like we were going to be about half of that, but with the pandemic. And again, I say that ad, when I said yesterday that we received the extra $9.5 million from the state and federal governments, some of that was directed for the nursing home itself. So I know the 4 sounds like a lot, but there are the alternating revenue streams that are coming in. And frankly, something that everybody here should be concerned about, our sales tax diversion that happens. So we really don't sales tax people 4%. It's really 3.95% because some of it the governor has taken for AIM funding and some of it for the distressed nursing home and hospital fund. That should be a fund that we should have access to, but we've really been given no guidance as to how we get to that state pool of money. So that's another revenue that we're hoping to offset that, Brian, going forward, because frankly, it's monies that should probably stay here in the county, but through state law, they've diverted a small portion of that. So we're working on it.
So we'll then move on to Schenectady Job Training Agency. revitalization grants or monies that we're doing for the land bank. The Small Business Development Community Center. Veteran Services.
Page number,
Well, that's page number 208.
thank you.
Page 209 goes into the Consumer Affairs, Weights and Measures. Again, that's another revenue generating area for us in the county.
With only 2 people.
I know they do a lot. And then senior long-term care. I know the director's here. Thank you very much for being here. There's some significant things going on in American history tonight. And I think it looks like we might, when we return tomorrow, Mr. Chair, we would continue with the recreation area and the library and the rest of the budget. Is that okay, sir? Thank you very much. So with that, members of the legislature, we will adjourn this evening and return tomorrow after history is made this evening. Thank you very much.
I think he's talking about the baseball game, I believe.